Good morning. It's great to see all of you. Thank you so much for being with us this morning. Welcome to the 14th annual release of our Community Needs Evaluation. We are so excited to have you with us today. We are thankful to be here at West End Community Church and at their beautiful facility. Thank you so much for allowing us to be here and use your facility today. And I'd also like to acknowledge any public officials that might be in the in the audience. If you please stand so we may recognize you. And if there are any other officials running for office, if you're in the audience, if you would please stand as well so we recognize you. Thank you so much for being with us today. Social Services has produced this Community Needs Evaluation for the past 14 years, which uses objective data that is regularly updated to inform the community about the important trends and topics related to the demographic and socioeconomic patterns of Davidson County. This edition carries a tradition of providing the most recent data, along with key updates on emerging issues in our society. The focus on this year's Community Needs Evaluation is on the cost and challenges of aging in Nashville. And I'm so excited to have this topic featured in this Community Needs Evaluation. And thank you so much for being here to hear about this today. But before we get started, we have a great presentation from the Uprise director here, Al Brady. He is the admissions and recruiting director, and I'd like to call him up. He's going to welcome us here to the facility and tell us a little bit about Uprise Nashville. Thank you.
Good morning, everybody. Oh, thank you, my friend. Nervous I get lost without the clicker. Good morning again, and welcome to West End Community Church. It brings me great joy to welcome people like yourselves who are doing great work in the community, on the ground, really trying to better the lives of, our fellow Nashvillians. Got to get used to that word, Nashvillians. And so I'm excited because I get to share 3 quick points with you all. Number 1 was that I did again want to say thank you. Thank you for the hard work that you're doing every day. Thank you for some of the people on our team call it a glorious grind, where we're trying to help people who are in those lesser positions in life. We're really trying to help people move up and have a great quality of life. So thank you so much for the work that you're doing for our beloved city. Second, which is what I get to do every day, I'm super thrilled to talk to you all about a fantastic career development program, Uprise Nashville. I'm sure we can figure out why I call it fantastic, right? It's on my chest. So Uprise Nashville is a career development program created and formed right here in our community in this building. And the mission of Uprise Nashville is to help individuals who are currently unemployed and underemployed gain the necessary skills and training to pursue careers with pathways that offer upward mobility. And they also help that leader, as we would call the participant, move into a position of financial self-sufficiency. So if you were looking for the Cliff Notes, in short, we help people move into a career, not a job. If you hear about Uprise, it's not a job. We're moving into careers with upward mobility. And in fact, I would love to take this moment before we dig a little deeper to have some of my leaders share with you about Uprise Nashville.
We were homeless. No family, no resources, literally nothing.
You name it. And I was waist deep in it. I thought that I was a lost cause.
Didn't care if I was on this earth another day or not. I felt like I didn't have anything to give, so I just continued with what I was doing.
People who come to Uprise come from all different kinds of backgrounds. Most of them have some kind of barrier to employment. They may be single moms who were never able to go to college. They may be people who are in recovery from addiction. They may have a criminal history. Those people come to Uprise and they start to dream about what's possible.
Uprise landed me a dream career. They sharpened up my soft skills and we made my resume, and I was like, man, I've got an impressive resume. Like, I could get a job anywhere.
The idea of Uprise is to equip people with short-term training, short-term education that gives them skills so that they can enter the workforce in areas of need that Nashville employers have. And once they have that training, they can get into jobs with upward mobility that allows for them to provide for themselves and for their families.
I wouldn't be where I'm at right now if it weren't for Uprise. That's just the truth about it. They've had a hand in everything that I've done.
Sometimes I need to pinch myself just to be sure I'm not dreaming, because even in addiction, I would be like, what if life could be different?
Our hope is that they would leave Uprise knowing that they are loved, knowing that their Creator loves them, and knowing that they have a clear pathway forward where they can provide for themselves and for their families and become self-sufficient.
Sometimes it still feels like I'm not worthy of it. And I have to look at the evidence in my life, and the evidence says that I am worthy. And then if there's hope for me, there's hope for anyone.
And so, across 3 cohorts a year, Uprise accepts over 150 people who are living here in Middle Tennessee. And with world-class coaching, we provide them with world-class coaching and opportunities to grow into a career with upward mobility. Our graduates earn an average of $21,800 more per year in their first year of work. And this experience, this summer we'll be welcoming our 15th, I'm so excited, our 15th cohort of individuals. These leaders, again, that's what we call a participant in Uprise. So if you hear me get stuck on that word, you know who I'm talking about. Again, these leaders will be looking to change their professional trajectory and upgrade their skills. And what makes our program so special, what makes Uprise so magical, is that we build this class through collaboration. We build this class with Uprise partners, other people who are making change, who are change-making organizations, like people in this room, and organizations who are looking to help make our city better. And so we partner with organizations who have leaders, who have participants there that are looking to change their financial trajectory, their career trajectory, and so we walk together. See, I was gonna say, make sure I did that right. And so this brings me to my very last point, my final point, is that I would love to extend a special invitation to everyone here who is actively doing the work involved with, on the ground, making Nashville a better place, making lives better for individuals in this city. I'd like to extend a special invitation for us to collaborate. Uprise, we believe that significant change can only happen with significant relationships. And we believe that with our leaders, building a bond with them, having a significant relationship, that's how they're able to begin to build that community that allows them to grow. And I believe that's the same with organizations like Uprise and like the ones you're here representing. My hope is that before we leave today, we can connect and collaborate, and we can really build this community of collaboration. So transparently, I'm from Nashville, so as I ride through the city, you have one of those movie montages where you see buildings going up and things going down, and people used to be here, and there used to be a guy here on the street with a hat and this and that. And so I'm from Nashville, and I know we've seen over the last few years that our city has had a lot of situations. We've gone through pandemics. We went through the big toilet paper crisis a few years ago, and we made it on the other side of that. Some people remember that was a real thing. But in Nashville, we know that there are concerns. There are needs. Some would even say that there are problems that can seem overwhelming, borderline impossible. However, I know without a shadow of a doubt that this community of collaboration, people in this room working together, is the absolute best answer for the concerns that face our city. So in short, my friends, here, make sure I click it right, is my information. And I would love to connect, collaborate. coffee on Uprise, because I believe that absolutely the answers that our city needs is us collaborating in this room, organizations like ours working together, and we would be able to tackle problems that we cannot tackle on our own. And we could really, we're already making a difference, but I think we could really be the absolute answer for our city as we work together to really build collaboration and make differences for our city. So thank you all for being here at West End Community Church. Welcome again. Please, there's my information. Uprise will be in the hallway. I would love to take time to meet each and every one of you and figure out how can we collaborate to make life better for people in Nashville. Okay? Thank y'all.
Thank you, Al, and thank you again, West End Community Church, for being a gracious host to us today. Welcome again, everyone, to the presentation of the 14th Annual Community Needs Evaluation. This report on the state of the economic and social well-being of Nashville and Davidson County allows Metro Social Services to fulfill its mission to analyze and report on current patterns, trends, and emerging issues. This year, the report's special focus on older Nashvillians results from important contributions from a number of key organizations in our city. Metropolitan Social Services wishes to extend its gratitude for the time, thought, energy, and insights of the organizations that are listed on the screen as we've developed this report. Many of you are here representing those organizations, so thank you. Last year, we shared with you the 13th Annual Community Needs Evaluation. That report focused attention on the theme of the big squeeze. As Nashville housing costs rose by 55% in 4 years, rent by 65%, meanwhile wages increased by only 12% during that period. Other costs in groceries, gasoline, and other fundamentals squeezed Nashville residents in extraordinary ways. Even so, the burden of rising cost of living does not fall evenly across the population. While many face economic hardship, those without alternatives to work more, to change jobs, to get more education, or to make other major life changes are those who face intense hardship. The older population of Nashville, those aged 65 and over, are just such a population. Nearly 1 in 7 Nashvillians is 65 or over. This group, nearly 100,000 persons, very often are highly limited in their ability to work, save money, relocate, or otherwise enhance their ability to make ends meet. Many are on fixed incomes that the recipients cannot alter. This group also represents the fastest growing age group in Nashville, all of which leads to the focus of this, the 14th Annual Community Needs Evaluation, on the older residents of our city. In just about a decade, the older population has added approximately 30,000 persons, as the graph shows. There are 3 components to understanding the current topic of aging in Nashville. Those are the cost, the context, and the challenge of aging. First, we look at the cost of aging for the residents of Davidson County. The federal poverty rate for older Nashvillians has remained between 8 and 11% over the past decade. Yet the number of those living in poverty has grown for each of the past 5 years, now with the largest number of older residents living in poverty in history. In fact, in the U.S., poverty declined for all age groups in the year 2021, the most recent year for data, except for older Americans. One important caveat: the federal poverty thresholds themselves are very low. Currently, a single person is not considered below poverty unless his or her income is below $14,980 a year. To repeat that, an older Nashvillian living alone could have an income of only $15,000 a year and not be considered to live in poverty, according to the federal thresholds. In last year's Community Needs Evaluation, we shared that about half of Nashville workers earn less than a living wage. As this updated table shows, one adult with no children would need about $38,000 a year in income, and two adults would need almost $58,000 a year to meet basic living expenses. Currently, half of Nashville workers earn below $38,000 a year, meaning that half are in living wage poverty. But many older Nashvillians generally are no longer working. Half of older households in Nashville have incomes below $49,000 a year, and the mean Social Security income for Nashville households is merely $21,000 a year, and the mean retirement income is $26,000. The Elder Index estimates that an older couple with some health issues that either rents or owns their home requires approximately twice these levels to live in Davidson County at $43,000 and $48,000 a year. In short, older Nashvillians typically live on fixed incomes, experience very high and rising cost of living along with everyone else, have health needs unique to older persons, and, unlike younger persons, often cannot easily relocate or access basic needs. Just as half of Nashville workers experience living wage poverty, so about half of Nashville's older population experiences livable income poverty. The cost gap is not one that older persons have an ability to overcome. In the U.S., 40% of older workers and their spouses can expect to experience downward economic mobility in retirement. And only about 2/3 of American workers have any retirement wealth. Those that are fortunate to have some savings can expect an added lifetime income of only $300 a month. And with older age come increased likelihood of additional medical service needs. While it's highly desirable for older persons to remain in their home, the costs for needed assistance can be out of reach for many. Homemaker and home health services can average $57,000 a year in Davidson County. For those that require nursing home care, the cost in the Nashville area approaches $100,000 a year. Very often, this is not covered by any insurance, or in the alternative may involve spending down most of an older person's assets. In the U.S., a very large share of services for older persons is provided by organizations that function as for-profit entities. As shown in the chart, across the nation, 82% of home health care operates on a for-profit basis, 70% of nursing homes, and even 45% of adult daycare services. But many families also serve as the direct and the primary caregivers for older persons. In 2020, there were 53 million unpaid family caregivers in the U.S., an increase of almost 10 million caregivers in just 5 years, due to a rapidly aging population and the high costs of other care options. About half of those caregivers are supporting the needs of an older parent. The growth of care needs is illustrated by a projected increase of home health of 46% nationally by the end of the decade, with 1 million more workers needed. Tennessee, meanwhile, lags most other states in filling those needs, ranking as the 4th worst state in terms of a caregiver shortage. So the costs of aging and caregiving are many: financial, time, emotional, and opportunity costs. The financial costs. Caregivers often use their own resources to provide care. Many cut back significantly on their own health care spending to compensate. There are the time costs, as more than half of family caregivers are also employed themselves. Certainly the emotional costs, where many find caregiving filled with stressful tasks. Caregivers themselves may be older adults, and they may need to learn many difficult and complex nursing and care tasks. Overall, there are those opportunity costs which impact all of our society, as 1 in 3 workers have left a job in caregiving responsibilities at some point. The toll on caregivers is great. A study finds that older spouses can experience a 63% higher mortality rate in 4 years due to their caregiving responsibilities. In addition to the costs of aging and caregiving, which are many, there is the current larger context within which these situations occur. Older Nashvillians are simultaneously older Tennesseans. Tennessee lags in very notable ways in meeting the needs of older residents. Respected national studies and data indicate a state where services and conditions of older residents rank near the bottom. Tennessee ranks among the lowest 3, 6, 8, 11, or 12 among states for many aspects of meeting older population needs in health care, community support, caregiver support, and in many other services. In the Nashville context, there's an open question. The community rightly expends resources to meet the educational needs of its approximately 85,000 young persons of school age. At the same time, Davidson County has just a slightly larger number of persons that are age 65 and over. This then is the open question regarding what a collective local, public, private, and nonprofit expenditure is to meet the needs of a large and growing older population in our community. With costs of aging in Nashville high and rising, with the context of Tennessee's comparatively limited resources focused on the needs of older persons, what are the challenges that these lead to for this large and growing population? Perhaps unsurprisingly, data indicate that Nashville scores lower than many comparable cities for livability of older adults. The list shown are many of the cities that Nashville considers competitors as desirable places to live and work, such as Denver, Austin, Charlotte, and Atlanta. Certainly the largest cost item for many households is meeting the cost of housing. With exceptionally large increases in home prices and apartment rents across the board in Nashville, it's not surprising that over half of Nashville's older renters are paying more than a third of their income for housing. About 1 in 4 older Nashville homeowners is similarly cost-burdened for housing. And data show that well over half of the homes listed for sale in Nashville are affordable only to households with incomes over $100,000 a year. A reminder from our earlier slide that half of older Nashville households have incomes below $49,000 a year. There are not only housing cost challenges, but also challenges in the suitability of housing. In the U.S., only 1 in 10 housing units with an older person has needed age-ready features. Many homes of older Nashvillians are also older structures that require costly repairs. Lastly, the rapid gentrification of Nashville neighborhoods puts pressure on older persons to relocate, often without good housing alternatives available to them. Along with housing challenges, there are difficulties facing older Nashville residents in obtaining adequate and healthy food. Finances may limit an older person's ability to purchase what is needed. Limitations in physical mobility make it difficult for many to shop for food or carry purchases to their home. Even taking groceries from a bus stop to home may be a challenge. Older persons often may simply be reluctant to ask others for help. Metropolitan Social Services, which operates the largest public food and nutrition program for seniors and those with disabilities, frequently provides the only human contact which some older persons have during a day or for many days. In addition to providing meals, staff are able to assist with bringing in mail, taking out trash, and other helpful tasks. Dental issues of older persons may limit the types of food that are appropriate or desired. And many older persons live in neighborhoods where healthy food options are unavailable or effectively inaccessible for these other reasons. Older persons in Nashville join the overall 85,000 persons that are considered lacking in proper food and nutrition across the city. Among persons with one or more disabilities in Nashville, far and away the largest group is comprised of those age 65 and over. Approximately 1 in 3 older Nashvillians, or some 30,000 seniors, experience one or more disabilities. And for those that continue to work past age 65, the likelihood of working while having a disability of some type is quite high. A common thread through many challenges for older Nashvillians does involve physical mobility issues that are exacerbated by limited transportation options. Nashville is among the most car-dependent metro areas in the nation. It's also an environment where driving can be dangerous for everyone. In the nation, 1 in 6 drivers are age 65 and over, and even a very large share of the old population, those age 85 and over, that are still driving, contend with an urbanized driving environment that is challenging even for younger persons. With these and other complexities, social isolation occurs for many older persons. The CDC reports that social isolation increases an individual's risk of dementia by 50%. Meanwhile, data show that Tennessee ranks the 11th worst state for risk of social isolation. Research has even shown that loneliness and isolation can shorten life by 15 years, is the equivalent of smoking 15 cigarettes a day, and is more dangerous than obesity. Older persons are a uniquely vulnerable population. Fraud, fear, and frailty combine to create challenges that do face older Nashvillians. Taking older persons out of dangerous environments often means that there are no ready or desirable ways to relocate those persons into places of safety. Limitations in physical mobility are common as persons age. Ensuring that homes are equipped with the many small and large devices and innovations that make life easier for older Nashvillians will allow many more to remain in their home. A critical backdrop to the challenges facing older persons involves the role of climate change. As average temperatures rise and as extreme weather events become more frequent, numerous, and violent, there are disproportionately high impacts on older residents of our community. Older persons are more prone to heat-induced illnesses. They may also lack adequate heating and cooling equipment. Extreme weather events such as tornadoes and flooding are more likely to be difficult challenges for older persons in reaching safety. The aftermath of these events can produce greater mental health distress in older persons. And the destruction of housing through violent storms and flooding disproportionately affects older Nashvillians, as our community has seen over the past 2 decades. In total, older Nashville residents face many serious costs greater than their incomes, broader contexts of few supports for their basic needs, and a multitude of challenges that are unique to this large and growing population. Thus, a city that indeed values its older population demonstrates those values in tangible ways. These values can include assistance to navigate the many social service needs of older adults, inclusion of needs of older adults in the many aspects of civic life and infrastructure such as building codes, community plans, transportation, health, and other services, and ensuring equitable representation of the views, preferences, needs, and concerns of older residents of our community. With the population that has contributed to the success of Nashville over many decades through hard work, investment in family and community, and desire to see a city livable for themselves and for others, the commitment to this older population is important and necessary for everyone. Expanding and elevating the awareness, understanding, and urgency of meeting the needs of older Nashvillians through data and analysis is a primary focus of this year's Community Needs Evaluation. The sometimes silent or invisible population of older Nashvillians is one that is large, growing, and deserving of the efforts of the whole community to meet their unique needs and appreciate their valuable contribution to the city. Truly, the well-being of older Nashvillians does require a community priority. At this point, I'd like to introduce our second speaker, Dr. James Powers. Dr. Powers is professor of medicine at Vanderbilt, where he runs the Geriatric Fellowship. He's also the associate clinical director for the Tennessee Valley Geriatric Research, Education, and Clinical Center. He holds an MD in distinction in research from the University of Rochester. He developed a geriatric clinic at Vanderbilt, as well as a consult and senior care service at the VA hospital. The author of over 100 papers, books, and book chapters, he's in demand as a lecturer and has devoted his academic career to geriatric nutrition, education, and healthcare quality and safety. Dr. Powers.
Well, it is indeed an honor to be here at this launch for the Community Needs Assessment. And I want to thank all of you for your commitment to helping better the care and the lives of older Tennesseans, older Nashvillians. And for that, I thank you for your support. We are truly living in a special time. Never before in the history of the human race have we had so many older individuals among us. This graphic indicates that in the early part of, well, actually not very much time from now, about 2050, a little bit later than that, we're going to have over 1 million centenarians in our country. That is just amazing. And that just indicates the prevalence of aging throughout the world. We don't really know what to do with that. We're going to have many people living to ripe old age, doing well, we hope, but we're also going to have many with many care needs, as you are well aware. This is the way we used to think of aging, as a pyramid. A lot of younger individuals at the base of the pyramid, and as we got older, fewer and fewer individuals. In fact, the average age in 1900 of U.S. citizens was about 49. Isn't that amazing? Look how different it is as we look to the future, a squaring off of the demographic curve. And so we're having to deal with many, many older adults in society. And knowing how best to do that, addressing their needs, addressing the needs of the families they live with, is why we're here. Let me tell you a little bit about my passion. I'm a geriatrician, and I take care of older adults. It has been an extremely rewarding professional life for me. Unfortunately, there are very few of us. In fact, the statistics would indicate that we could use probably 7 times as many geriatricians. We've learned to develop teamwork in taking care of our older adult patients and the families that they live with. And we reach out to our colleagues in nursing, social work, physical therapy, chaplaincy, nutrition. All of those are just so very important. Our goal in taking care of an older adult is to promote wellness and independence. We focus on the performance of that individual. What can they do for themselves? What do they need help with? Knowing the answers to those questions really helps us guide our treatment strategy and the care needs. This may include looking at the physical, cognitive, emotional, and social domains. In fact, we know that many times the issues that we deal with are predominantly in non-physical areas, non-medical areas. Again, another reason to reach out to colleagues in so many fields. So we are interdisciplinary, multidisciplinary. We like to perform screens and then go into more detail as needed. Not every person needs an in-depth evaluation, but those that do, we try to target those areas. And again, the success that we're measured by is have we maintained or improved the quality of life for that individual. I'll give you one more picture here of the assessment that we do, basically focusing on quality of life, but knowing that there's an overlap from so many different areas and so many different disciplines. Well, that's a little bit about what I do, but taking care of individuals, while very important, is one aspect of what we do, but reaching out to the broader community, looking at all of the needs that impact on health and quality of life is just so very important. I'm going to give credit to the World Health Organization for these concepts that we're going to talk about in the next few slides here. The 8 domains of livability. These are areas that the World Health Organization has found to be important, critical actually, in looking at the health of communities around the world. And they go back to about the year 2006. So looking at spaces, outdoor spaces, transportation, civic participation, and engagement. Also looking at communications, looking at the impact of livable spaces for others, and also looking at the environment and social engagement, and the ability to make sense, to have an impact on what you're doing, make sure that the activities of the older individual are meaningful to them. There are a number of cities around the world that have become age-friendly, and indeed, I would like to also now give credit to the American Association of Retired Peoples. AARP has reached out to develop age-friendly communities around the country and in Tennessee. AARP has reached out as well. And we have about 11 cities right now. Some others are on the list for expansion, and working together with their city councils, with their communities, with their counties is so very important to develop a lot of the resources that are just critical to maintaining a quality of life and also care for individuals and their communities and families. I think that Metro Social Services and I have both been very interested in the work of AARP and also the National Alliance of Caregiving. And I'll put things together in kind of a pictorial form that I think helps demonstrate what caregiving is all about. And I'm going to focus particularly on the care of dementia patients. When you have a dementia patient, somebody suffering from Alzheimer's disease or related dementias, and their caregiver, we know as clinicians that you've got 2 patients. You've got that individual who needs your help, but you also have a caregiver who's equally in need of their care. And it turns out that individuals who do take on the role of caregivers, and many of us are going to be in that category, are numerous. The last count that we have is over 50 million of us. We also know that that this is very costly in terms of health and economic consequences. And many of these individuals function as unpaid caregivers as well in the and over a long period of time, and supporting them is just so critical. The Milken Institute has developed a number of recommendations for the care of dementia patients and their families. And I'll just demonstrate it with this slide here. One has to have continuing care, obviously, and interventions from an emotional and social standpoint, but also an emphasis on self-management and caregiver support. This may include medication, treatment of other conditions, in addition to the lack of cognitive function, but also coordinating that care. And it turns out that it requires many different healthcare professionals in order to do that effectively. And we're going to talk about care team navigation. And a lot of medical care right now, and actually the way that we organize services for healthcare, for social services, kind of based on a specialty viewpoint, where you have a single condition and there's a single answer, a single treatment specialist, a single maybe best practice standard of care. That is definitely not the case when we're talking about cognitive issues, and in fact for many other care issues. You have community resources that are outside the local sphere of care. You also have healthcare providers. You have that individual who's affected as well as the caregiver. And you have what we'll call a care team navigator, who might then help coordinate care with a nurse, a social worker, or other individuals. I had a call yesterday from a colleague, a specialty care individual, who asked if there were any resources to help families. This individual takes care of chronic illnesses, mainly kidney diseases, a very important specialty. But she was not aware of the coordinated resources that are available in the community, and she really wanted to know, who can I send this family to, this patient to know what services there are out there to take care of this patient. And it struck me that we're really not teaching our trainees, not teaching our colleagues how best to care for individuals who need these services. Telling this individual about all of the rich community resources that Nashville has, the fact that there are directories, that there are many organizations that could help, was really kind of futile. I think that the mentality was, I just want somebody to fix this, not me. Can I send somebody somewhere? And unfortunately, a lot of care remains that way. And I'm going to talk with you about a different model of care, more of a care team, more of a dementia-capable workforce, and using the example of dementia as perhaps one of the more extreme examples where the need exists. Dementia care navigation can be defined as really a coordination of care for the individual with Alzheimer's disease and related resources. When you first meet an individual with a cognitive decline, there's a lot of education, there's a lot of questions, there's a lot of fears that both the individual, if they can express them, as well as the family has. It requires a lot of discussion, a lot of time. Many times there isn't that extra person in the office. There's not a care team navigator or a nurse or a social worker available to do that. And many times that conversation never happens. If we talk with families, if we talk with really the community about their experience in the care of dementia-related issues, we find that there are many, many gaps in care. providing that individual assistance to make it easier to find care across many settings is difficult, as my colleague demonstrated by the question that I got yesterday. These are high-risk and high-need individuals, and they can be identified not only by their diagnosis, but by many of the other things that are deficits. Remember that we do an assessment for the need for social services, need for transportation, financial needs, and all of this it turns out to be extremely important, but difficult to get, but can be gotten by many different team members. So I'd like to talk about a framework for how we can define care across the continuum and the need for services. And this is basically a patient-centered medical home. Talking in terms of how we currently deliver health care, many of the services are what we call fee-for-service, where an individual comes in, gets a procedure, say a knee replacement, and that is reimbursed to the providers, to the healthcare system. But you see that the care for older adults often requires much more than a simple procedure, much more than a straightforward care plan. So having available other individuals to help, such as care coordinators, nursing, social work, pharmacists, is just so very important, but very difficult to provide under a fee-for-service plan. The Millikan Institute is very supportive of looking for alternative practice models, such as value-based purchasing, if you will, where the healthcare system is rewarded by a quality measurement criteria and then reimbursed on that basis. And one can do that through some of the alternative management plans, such as Medicare Advantage and also Medicaid, Medicare waivers that are possible. Many of the individuals that we're talking about that need services are going to perhaps be eligible for Medicaid in addition to Medicare, so making sure that they are included in any of these evaluations is very important, and the Medicaid serves as a resource for them. Many individuals who are in this category also have many deficits of activities of daily living, and in fact, if they do have that, we know that their long-term prognosis is much worse, no matter what the illness is that they're being that is being addressed. The ability to cover the cost of care for all of these healthcare professionals is challenging under traditional fee-for-service. The coordination of care, the codes that are used in order to bill Medicare for these services are quite complex and best addressed through some alternative practice arrangements. Currently across the country, only 15% of healthcare is under these guidelines. It is slowly increasing and being encouraged by CMS, but unfortunately, it is a barrier to providing more comprehensive care. The electronic health record can also be used to advantage to help identify, manage, and track individuals, provide and identify gaps in terms of their needs, and perhaps have a more informed home health care information and interoperability with other healthcare records. We're really at our infancy in terms of using the electronic health record to assist with these issues. expanding this concept, if I can call it a business model, is really so important. Promoting the provision of these types of services can only be done under what we call a cost avoidance model, which is different from a profit model. And so alternative payment models that support comprehensive care, especially dementia care, and that reward providers that help reduce cost is so very important. One of the things that we have found in many of the teaching programs that I run is that in having a team approach to the care of individuals, that having a model that promotes the practice of each individual healthcare professional at the top of their scope of practice is the most rewarding as well as the most effective for patient care. We talked about healthcare coordination, the time it takes to talk to individuals and their families. Well, if that can be shared with the nurse, shared with the social worker, it's really to the advantage of the family and the patient unit, but also to all the practitioners in the group. Making sure that we also pay attention to the nursing assistants in long-term care and also to those who provide care coordination, such as care team navigators, requires that we have certifying programs that allow for a career ladder and appropriate reimbursement for these services. One of the things that we found through the pandemic, national meetings that particularly involving long-term care, home and community-based services, are that the care partners, the nursing assistants, professional organizations, have a lot to say about what's appropriate, what they need in order to survive. And we know that many long-term care facilities are really dependent on the staffing. Many of them are challenged right now to have appropriate staffing. So supporting the education, supporting the career ladder, supporting the satisfaction of the job is very, very critical. There are couple of programs that are just really scratching the surface now to help develop the job market really and to support the development of education models for training, and that's the John A. Hartford Foundation and as well as the Health Services Resource Administration, that's HRSA, a federal agency. They have a number of grants to help reward educating or developing new programs to educate care coordinators and healthcare assistants, and to help develop models for sustainment and to develop new approaches to improving job satisfaction. One of the things that I've been proud of in terms of geriatrics is that we've tried to do as much as we can with so few resources. Just getting other physicians, other trainees in many fields interested in the care of elderly patients is a challenge itself. But learning to work together in a coordinated fashion with others in the community and respecting other healthcare professionals as they provide care has been extremely rewarding and, as it turns out, very effective. We're finding that many families, many patients are extremely grateful for the care that they get, and by helping all healthcare professionals, whether they want to specialize in gerontology or geriatrics, is not really the goal. It's to make them actually very good geriatricians for their own patients. And what I think I'd like to do is to stop and see if you perhaps have some observations, some questions, some ideas, some strategies that we could use going forward. And With that, I think I'll stop and open up the time remaining for some questions. Is that all right? Okay. Thank you. Okay. Will is going to ask some questions. Okay, Will, I'll turn it over to you. Thank you.
Good morning. Thank you again for everybody giving us your valuable time this morning. The first thing I wanted to do was extend another thank you to our speakers. Without your research and your knowledge and your effort this morning, a report like this and highlighting some of the challenges and gaps that we have here in Davidson County wouldn't be possible. So another round of applause for our speakers, please. You know, about 7 months ago, our division of strategic planning at Metro Social Services began formulating ideas around what this year's report might look like and how we might begin to turn our collective resources on, a valuable and an important topic here in Nashville. And the idea of older adults came about, and we started looking around, we started seeing where gaps might exist. To start that, though, we looked internally at what we're able to provide, and while we have incredible services through indigent burial and through as being part of the state's largest distribution of nutrition to seniors, we understood that we are one amongst many in this field. And so we began having a number of conversations with partners who I'm happy to say are here in the room today, and began putting together what are the major areas of focus that we need to better understand, and where are areas where there are major gaps in our services. But we started putting this report together, and it's important to understand that while you've heard a lot about gaps and a lot about challenges for seniors, for older adults, as I was corrected. It's important to remember that a community that is respectful and is developing for its older residents is one where everybody can live. It's important to understand that from the many charts that you saw today, we will know the scale and the scope of the challenges that are ahead of us. Today's 55-year-olds, tomorrow's 60-year-olds will be the future's 65, 70, and centenarians down the road. We know that these things are coming at us, and that is why we feel that it is important for us collectively to come together and find opportunities to join hand in hand, and while we've identified gaps, find ways of taking a step forward together to make sure that we're better able to provide a community that is supportive and inclusive of everyone, including our older adults. Now, I wanted to highlight just a couple of the things you heard today. Obviously, our older adult population continues to grow. You saw that it's the fastest growing cohort here in Davidson County. It's important to understand that, while we've seen 1% to 2% of general population growth here in Davidson County, we see 4% to 6% growth year over year here in Davidson County with regards to our older adult population. That population is also not going anywhere. If we were to look at the top 10 council districts for where older adults lived 10 years ago, we would only see one of them that is not one of the most populous council districts today. Also, when we look at home ownership rates, we see that the home ownership rates continue to stay steady over that same 10-year period of time. So they're not going anywhere, and they're staying in their homes longer. So we understand that this is a problem, or it's a challenge that we have to meet head on. In addition to that, Tennessee Department of Transportation, they're very cognizant of how people are moving around the state. They do annual assessments of where people live so that they can make better plans for how to move people around. They estimate that not just here in Davidson County, but throughout the Middle Tennessee region, there's approximately going to be about 485,000 older adults, those over the age of 65, that live here by 2040. So it's not just a challenge that we have here in Davidson County. It's something that we have to think about even more regionally than that, because while they may want to stay here, they are going to need to travel to doctors' offices. They're going to need to travel to see family. They're going to need to travel to go to their religious institutions. As you heard from Dr. Harper this morning, the cost of aging here in Davidson County is not getting any cheaper. When we look at average Social Security payments, we see that here in Tennessee, payments are on average less than $1,500 a month. You also heard that average income for those who are no longer working is less than $17,000 a year. The cost that I'm sure we all feel every time we go to the grocery store, every time we go to the pump, every time we pay rent or we pay our mortgage, we know that those costs continue to rise year over year. And so I'm sure we all have heard it's most important to think about those costs in the context of those who have fixed incomes. And while we all live on budgets, we might have the opportunity to earn a little bit more money here or reduce our expenses there. But when you're worried about things like medication and the doctor's visits that you must go to on a day-to-day basis, these are fixed costs that most of us don't have to deal with. We heard mention about social isolation and the significance of its impact on our older adult population. It was surprising to me, and as someone who has my grandmother, who's still with us, luckily back in Arizona, her social isolation is something that I think a lot about. If we consider that for someone who's deemed to be isolated, that their life expectancy has been reduced by 15 years, we understand that being connected is one of the most important parts of longevity and living as an older adult. So when we think about getting from place to place, when we think about where people are living and the types of places that they can live, we truly need to understand that it's not just helpful to be able to interact with others. In fact, for older adults, it's critical to their longevity. Also, we need to understand climate change has a greater impact on older adults than it does on our day-to-day lives. You and I, considering if a climate disaster was to happen to us, a tornado, a flood, even a simple power outage, we can, with some ease, put our belongings in a car and drive somewhere. We can relocate to families and friends' house. But when we consider our older adult population, they don't necessarily have the mobility that we do. They don't have the ease of access to transportation, or they don't necessarily even have the access to family that many of us do. So understanding how this climate change and the increased frequency and severity of climate activities is impacting our older adult population is also really important. It may be a slow moving and gradual move towards more severe weather, but nonetheless, it's something that we should be cognizant of. And we also saw on the chart that Tennessee is a growing place that has age-friendly communities, which is great, and we applaud the efforts of all of those public agencies across the state that make those efforts. But what you may have also seen on that screen was AARP's index score, which was 47. The national average is 50. And that articulates the simple point of many of the benefits, many of the opportunities to engage both socially and economically for older adults is below average. It's also worth pointing out that they have a score for Davidson County. That score for Davidson County is only 49. And while slightly better, there's still clearly efforts that can be made to improve upon the resources and access that our older adults have. Now, as I said, when we embarked upon this journey to write this report, we sat down with a small advisory group that we have. We took many meetings with organizations who are already doing work in this space. And again, I applaud each of you for your work that you're doing and for being part of this effort today. But we also found that having a specialty or having a specific mission for each of your organizations sometimes can lead to disconnection between those resources, and we find gaps. Obviously, you heard a lot about challenges today that face our older adult population, and while we're all working in our specific siloed areas, we really could be taking a new opportunity to find a way to walk down a path together, finding ways where services can overlap, where we can connect requests for services with services that are provided by another agency. And so I'm up here to ask and encourage each of you to consider attending an event that we are planning on hosting and facilitating later this summer, where we'll be bringing together our advisory group. We'll be bringing together anyone else who's interested, so you'll be getting an invitation from me again. Where we'll be getting together, we'll be bringing national speakers in to facilitate a conversation about how can services be linked together? How can they be connected from one place to another? You heard earlier on that there are plenty of older adults and their caregivers who, when they call a phone number, it ends with just a call and perhaps even a reference to a place to go. But what we need to find opportunities, what we believe needs to exist, there are opportunities where an individual who's calling in for a resource can be connected directly to that. It's obviously no simple task. It can't be solved tomorrow, but as I alluded to, we know that this is a coming challenge. It's not, it's not dire today. It is a challenge for many, but we know that these are the issues that are going to be facing us down the line. And so we would challenge each of you to take the information that you've heard today. We ask that you consider what opportunities your organization might be interested in cross collaborations with. Again, you'll be hearing from me about joining this effort. But really, we understand that individually, there's only so much we can do. Even as Dr. Powers was talking about other medical agencies that are finding new ways for cross collaboration in terms of dementia care and health care, only through collective effort can we find new ways and really move the needle to improve the lives of our older adults. And with that, I'm going to ask of you to help us out. As you all walked in, you got one of these information cards where we give you lots of highlights about what you heard today. And inside that, you got an agenda. At the bottom of the agenda is a QR code that if you whip out your smartphone, that statistically most of us have, we'd like you to scan that and participate in just a short survey where what we're looking to better understand are, what are your priorities? What are your understanding of the challenges for older adults, both personally and even in the context of what you've heard today? On the back of that same paper, if you don't have a smartphone or if you don't want to fill it out electronically, you can also fill it out. I've got my colleagues Jali and Jeff in the back of the room with some pens, so if you need a pen, please raise your hand. But you could also just fill this survey out and leave it on your seat. This will go a long way to helping us better understand how to prioritize some of the challenges that you've heard today. It'll also give us some scope and what are some other areas that we might need to be focused on. But again, I want to leave you with the challenge. How can we find ways of walking down this path, this challenge all together? I want to mention also, during our time of development of this report, we had a chance to meet with the West End Community Foundation. We know that they're working on their own efforts this summer to host an event where they'll be getting together statewide policymakers and solicit and develop new tools for collaboration in that regard. And we believe that beginning with today's event, working with others in the community in other organizing events, and hopefully by this summer, we can continue to build momentum and a growing colloquy, if you will, of what we can do to better our lives of our older adults. And with that, thank you for your time, and you'll be hearing from me in the future. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.